Thank you for sparing your time to join us this morning on the launch of the 10-year health supply chain roadmap, an extremely very important document for the health sector and for this country.
I have the pleasure to join you on this important occasion of launching the 10-year health supply chain roadmap for Uganda. I'd like to appreciate all the efforts that have gone into the development of this 10-year health supply chain roadmap.
The roadmap provides a framework for transitioning from donor reliance to funding health commodities to increasing government capacity for domestic resource mobilization. The roadmap is intended to raise performance, resilience, and responsiveness of the health commodity supply chain to optimally meet the health needs of the Ugandan population. The 10-year supply chain roadmap is built on a foundation of 4 objectives. One is focusing on transition of the financial plan, the supply chain efficiency, effectiveness, the conducive policy environment and regulatory environment, leadership and ownership.
When we talk about governance and leadership, we're really going to rely so much on Ministry of Local Government and Ministry of Public Service. They are backbone of this.
We have approximately only 4,000 health facilities reporting into the national database, and there are 6,000, so 2,000 are off the grid. But even of the 4,000, only 51% attempt to report. That means if you write a hospital name and district and submit, is that an adequate report? No. Sadly, only 7% submit complete reports. Magic bullet will be integrated digitization of the supply chain system, complete, so that you have visibility of the medicines from the warehouses to the health facilities at this level.
This effort will be successful if the whole of government gets behind it. If it's just the Ministry of Health, it won't be successful. If it's just the Ministry of Local Government, it won't be successful. Everyone has to work together on this to be able to achieve results.
To this effect, Office of the Prime Minister will now chair the Interministerial Task Force based on the one government approach that entails that all players do their roles.
In a special way, allow me to register our appreciation to USAID and the strengthening supply chain activity for the financial and technical support in putting together the roadmap. My ministry would like to commit to provide technical oversight, enforce quality assurance, monitor and evaluate the implementation of the roadmap. My ministry will also ensure that there is an enabling policy framework for effective implementation of the roadmap. The implementation of this roadmap is estimated at US dollars 44.8 million across the 10 years, nearly 50 million US dollars. This investment will be needed to ensure that the technical implementation environment, that is the human resource, ICT equipment, operational management, and supervision is all addressed, both at the central and the local government, to effectively oversee and run the health supply chain in the country. Right Honorable Prime Minister, for the health sector to be responsive to our people's needs, we need power, appropriate technology penetration in all health facilities, adequate human resources, medicines, and conducive environments.
But the assurance I want to give this meeting is that we are now going into the 5th phase, where we are going to do the last mile connections and ensure that all the health facilities are connected, working together with the Ministry of Energy to ensure that electricity is extended to all health facilities so that we can address this question of access to connectivity, electricity, and the other utilities. In the next 2 years or so, we should be able to have connected. So our plan is shorter than the 10-year. So for us, we're talking about in the next 2 years.
We have a total of 535 computers purchased by the support from the American people through USAID. And those 535 computers are going to go to 350 health facilities in this country. And today, as I speak, we have a promise to get an additional $2.3 million, which is going to give us 700 additional computers to support an additional 350 or 400 health facilities.
We shall continue to give support to the Ministry of Health through reviewing the structures and the management systems to ensure that they support new changes like this one, especially the delivery of timely, cost-effective, and efficient health care to the population.
The Ministry of Finance, Planning and Economic Development, to the extent of resource availability, shall do whatever it takes to do its part in financing these activities.
In furtherance of the objectives of the roadmap and in support of its implementation, the Ministry of Local Government issued a circular to all the Chief Administrative Officers, town clerks in November 2021 to incorporate health commodities supply chain leadership and governance in the district annual work plans.
So I appeal to you all to really put forth the effort and live up to these commitments that you're making today to ensure that this roadmap is a success. The development partners will stand with you along the way. Let me also point out that 10 years is not a long time. There's no time to waste as we begin this journey together. The transition process should commence this financial year, if at all possible. I congratulate the Interministerial Task Force for their unwavering commitment over this past period of time under difficult circumstances to develop this 10-year plan that will benefit Uganda's health sector for years to come. So congratulations to you all and well done.
I want to thank the development partners and all of you who have been in this program for the job well done. With these few remarks, I hereby launch the 10-year health supply roadmap for God and my country. I thank you.